As part of a truly patient-centred health service delivery, it is important to involve consumers' perspectives in the clinical incident investigation process. We will explore how to involve patients and their families who have been directly involved in a clinical incident in the investigation process in another video. However, in this video, we will explore how we can ensure that we approach our investigations in a way that understands and critically reviews our processes from the perspective of our patients and our consumers. In Australia, the National Safety and Quality Health Service Standards provide a nationally consistent statement of the level of care consumers can expect from health service organisations. These standards set out the basics of clinical incident management and state very clearly that consumers should be involved in the review of clinical incidents. Our consumers play a critical role in patient safety. With the exception of the very young, incapacitated, or our most acutely ill patients, the majority of our delivery of health services involves consumers who are both informed and consenting participants in care. Clinical incident investigation, when we take a truly systems view, needs to explore the role the patient played in a clinical incident, not only by looking at the patient factors that might have contributed to an incident, but also how a more patient-centred approach might have averted the clinical incident from occurring. Having a consumer representative on the clinical incident investigation team is a great way to ensure that a patient-centred approach to investigation can be achieved. Obviously, there are requirements with respect to ensuring the consumer representative is appropriately trained in investigation, is able to adopt a neutral position, and issues around confidentiality are appropriately managed. However, through our existing consumer networks, we should be able to put together a list of potential consumer representatives trained in clinical incident investigation at our facility, health service, or across our region. A set of key questions when undertaking clinical incident investigation can start to unpack the consumer's perspective and identify any potential factors that might have contributed to the incident. Key questions to ask during the investigation include: was the consumer fully informed? Did they understand the care plan? Were there any shortcomings in consent? Was the consumer aware of the incident? Could the consumer have said something to avert the incident? Were there any concerns raised by the patient, and were these listened to? Were there any concerns raised by the patient's family, and were these listened to? And were there any unresolved concerns? Most importantly, the consumer's perspective is important in considering how the consumer might play a role in ensuring an incident does not reoccur. Typically, through recommending ways in which our consumers can be more involved in care delivery plans, being better informed, or more closely listened to when they raise concerns. Ensuring that the consumer's perspectives are included in the clinical incident investigation is central to creating health service delivery that is patient-centred. The systems view emphasises the role our consumers play in patient safety and how safety is achieved through active participation in developing a plan of care, being informed about a consumer's own health status and needs, and that at all times patients understand and consent to any procedures. Uncovering any shortcomings in this shared responsibility and patient-centred model of health service delivery is a really important perspective in clinical incident investigation.